Alright, this is my pre-lab video for inserting a male or female catheter. We're going to start with the male first, and then I'm going to go through and talk about the changes that are involved with a female catheter. So to start, again, this is my makeshift patient here. This is his penis. It's a toilet paper thing with a hole in it so I could show inserting catheter, but for now, so how we start is obviously PPE, hand hygiene, checking my patient's medical chart to make sure I'm doing the correct thing. I have all of my items off to the side here at an easily accessible bedside table. I'm working at an appropriate height. If we were in a hospital, I would probably raise the bed slightly, but this isn't too bad. So to start, I'm going to make sure my patient is on his back. I'm going to have his thighs spread here so I can do the work. And for sake of the video, I'm going to do this. So legs spread apart, and then we're going to want to place a quick little pad underneath the patient. So I'm wanting to get it in there kind of like this. Alright, so his legs would be obviously hanging down this way. I want to move the camera so you guys can see better. Okay. So, this is what we're going to look like. What I'm going to do first is I'm going to wash it down. I'm going to take a washcloth, wash all this stuff. Washing down, washing out your crease equally, not using the same washcloth, standard. Bathing things. After that is done, I'm gonna start preparing my setup here. So, as you can see, we were taught to put the sterile field here on the bed next to the patient. So what we're gonna do is here, we're gonna open this guy up, and then everything in this. This is all sterile. So the first thing we do is we put on our sterile gloves that are usually in the package. I'm at home right now, so I only have these sterile gloves. Putting them on the sterile way, obviously. For right now, we're going to focus on the actual catheter itself. So I'm going to ask my patient if he's allergic to any latex or iodine, because that's one of the things we could use to wash it down. So he's got to say no. Okay. What I'm going to do is I'm going to take all this stuff out. Push it here. These are my two sterile fields that I have. So what I'd want to do is creating a sterile field near my patient's genitalia as close as I can. The legs are not sterile, but you're going to have to work around legs anyway, so it's not that big of a deal. Another sterile field range extender here. So again, I'm just really trying to keep everything as sterile as I possibly can. So the next step we're going to do is we're going to continue to wash this guy further. So I would take, if we were actually doing this, the iodine solution, put it in there. If they were allergic to iodine, we would use hydrogen peroxide, which is also in the kit. So I would, kind of put it all in there. And then as you can see in this tray I have, is cotton balls, and then I would put the iodine in this area right here so that I could easily take these right here, get them wet, and then I'm going to be washing the client's genitalia with these cotton balls here. So, let's see if I can get this right in here so we can get a good shot. So, this will be the patient's genital region here, penis being here. So, I'm washing these. So I'm going to use these. Once it gets dirty, throwing it out. So we're gonna keep using new ones, and we're gonna want to get, retract foreskin, any nooks and crannies that we get. We're gonna try to get all of them with these cotton balls. Okay. So once I've cleaned my patient with these, I'm gonna move on to getting the catheter ready to go. This here I would use if we were actually doing the procedure. Loop comes with loop here. So we take that and then so the catheter would usually come in if it was unopened before. So this is the catheter itself here. It would come in like a sheath cover, so to make sure it's sterile. You just remove that by kind of bunching it up like a sock to the end, because what you don't want to do is pull it off and have it go like this. Have it fling around, hit something that's not sterile. So that's what you're doing. So once you get this out, take the lube. You put the lube in one of these side compartments here. So I put the lube in here, and then when I'm ready to lube up the catheter, this is what it looks like from a better angle here. I'm taking it in here and I'm rotating to get all of it. And I'm doing about 2 inches, but right where this stuff is ending, to make sure that, I don't want to shove it in with no lube, because that would kill this person. Enough on that. But, so when we're doing this, again, touching this to here is okay. These legs are not sterile, so you can't be doing that. So being cautious of that, taking the patient's penis, this position, all right, and we insert. I'm gonna obviously tell the patient to bear down, like they're voiding. And I'm gonna, I'm not saying that this is how to do it, but to give you a better view. Patient, so I want to face it up. So imagine the patient's laying down and I have it here. You insert the catheter like this. Sorry for the difficulty right now. It doesn't go through a paper towel too well. Okay, so once you're going to want to put it in there slowly and gently, obviously, not shoving it in. And then, all right, so we're in there. So once the catheter's in, how do you know that it's in the bladder? So, doing that, we would take this syringe right here of water, uncap it. And so, one thing I forgot to mention during this whole process, you're going to have one sterile and one non-sterile hand. So when I'm working on this guy, this would be my non-sterile hand, and this would be my sterile hand. So I can touch anything with this hand that isn't sterile, so the body, the penis itself. But this one sterile hand that I have stays sterile the whole time. So to check if our catheter is in the bladder, I'm going to attach the syringe to the catheter itself, and then watch what happens when I shoot this in. Uh-oh, see that? That's called the balloon of the catheter. So what you want to do is when you get it in there, when you think you have it in the bladder, you're going to want to inject all of this solution into the catheter. All right, and so you see how it's a balloon there? Let's say this is the bladder. The purpose of this balloon is to show you that you're in the bladder. So when I'm going to pull, I'm not going to pull too hard, but when I pull, I should feel resistance, like I'm in the bladder. And that's how you know you're in the bladder, when you feel resistance when you tug back. And then to remove the catheter, obviously, you'd want to drain the balloon like I'm doing slowly now, and pull everything out, everything you can. So yeah, that is inserting the catheter into a male patient. So the only differences that we can discuss now about inserting into a female, what I'll be using for this is a tissue box, just so you can kind of have it as a representation. So the differences when we're inserting a female catheter, Um, Differences include something like I'm going to want to put the client into a different position. So it's like instead of males where we're just laying down and have their legs spread apart, we would then do a little recumbent, so or bending the knees. So I'd have the female, the woman, in this position with her knees bent and open. Let's see if I can get a better shot of that for you. I mean, it's just my pair of pants, but this position. And then while I'll get this out, a couple things to talk about when inserting the female catheter. So all the same sterile field things apply here, except so when inserting a female catheter, obviously the vagina is built differently than the penis. So you can imagine there's the urethra is up here, and then the actual vaginal canal itself is lower. So say I'm inserting this catheter and I stick it in the vaginal region. What I would do is I'm not pulling this out because this is eliminating my possibility for any other mistakes. So when I insert this guy, if I insert it in the vagina, it's fine. I leave it in, I grab a second catheter, leave it in there, and then I go for the urethra up top. Some other things when talking about the female catheter insertion, the proper technique. So again, we talked about how I have one sterile hand and one non-sterile hand. The non-sterile hand, how you want to place your hands is at the top of the vagina. You're going to want to press down, and you're going to want to, you can see it here, I'm going to want to open. I'm going to want to keep everything kind of pulled back so I can see the urethra because it's hidden in there. So that's kind of the technique they teach us for the non-sterile hand touching the body. And then, so say we put this person's catheter in, say it's a woman, so here, catheter's in. After the catheter's in, all this stuff here, is good. Once everything's in, it's fine. What we're going to do is we would secure the catheter to the patient's leg. So say this is the leg here. I'm going to want to give enough slack to where, I'm not going to want to keep it like this. I'm not going to keep it tight because the patient can move, the patient's leg can move, and they need to be able to move without pulling the catheter out of themselves. So something like this kind of, where enough slack's where if they move their leg at all, it's not coming out of them. So that's how I position the catheter attachment to the patient. So obviously the bag here, you'd want to keep it lower, help have gravity help you out. So the bag will be below the patient there. You want to be vigilant and document everything that comes in this bag.